As we start to emerge from the COVID-19 pandemic, understanding and reconnecting to purpose, rediscovering our why, is key to moving forward. The healthcare workforce is facing unprecedented challenges and opportunities to redefine care delivery and encourage the next generation of leaders to use the lessons of the past 2 years to change for the better. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. Dr. Tom Yackel, president of MCV Physicians, the faculty practice plan of VCU Health System, is Senior Associate Dean for Clinical Affairs in the Virginia Commonwealth University School of Medicine and a past chair of the AHA's Committee on Clinical Leadership. At a recent annual meeting of the AHA in Washington, D.C., Dr. Yackel sat down with Elisa Arespacochaga, Vice President of Clinical Affairs and Workforce at the AHA, to share his thoughts as a clinical leader and practicing physician.
Thanks, Tom, for joining me. Really interested to hear your thoughts on the workforce, how you encourage new people to come into the healthcare workforce, and as a physician leader, what you're doing to support your own resilience and really bring yourself back to the work that you're doing. So let me start with the first question. Healthcare has always been a calling to some extent for those who enter the profession. There's a desire, you have a reason, you know what it is, why you got into healthcare. But as a physician leader, what would you tell those who might be interested in a healthcare career now, who those, young folks who are thinking, well, maybe I want to go into healthcare? What would you tell them?
Lisa, great to be here. And that is such an important question. I think all of us as leaders and providers in healthcare, we need to be asking ourselves that question. It's not just relevant for those that are thinking about being in the healthcare industry. It's extremely relevant right now for people that are in the healthcare industry and wondering if they're going to stay in the healthcare industry. So as I think about that question, I guess the question is, how do I feel about being in the healthcare business right now, especially being a provider? And I think the answer has to be that this is the most important moment for us to be providers of healthcare in this country. It is the most significant moment in all of our careers. And the reason is because, as you mentioned, we went into this for a reason. The reason is to help people, to reduce suffering, and to reduce the burden of disease. And there hasn't been another time in my career where that need has been stronger than it is right now. So our community needs us. It's why we went into this. This is our greatest moment. And we need to summon that courage to inspire ourselves every day to come to work, and especially to create the environment at work where other people feel the same way.
Absolutely. So you're a primary care doc. As a primary care doc, but also a leader of physicians, what would you be asking, and what are you going to go home and ask your clinical leaders to focus on to really advance care delivery? We have this opportunity to change healthcare based on what we've been through over the last 2 years. We have a lot of opportunity to make some changes and to make some adjustments. And we have a huge workforce challenge really hanging over us. What would you ask your clinical leaders to start to focus on and look at as they think about how they move into the next phase of their careers?
So critical to take this moment to reflect after all that's happened, because the world has changed and our perspective on the world has changed as well. So I appreciate that. It gets back to maybe that first question, which is, what inspires us to come to work every day? What are the things that really matter to us? And from what I can tell and what I've observed, people want meaningful work and meaningful relationships in their work, and both with colleagues, with patients and families. And so I guess the question is to go back and say, well, what does meaningful work mean to you, to me, as a doctor, as an administrator, as a patient, as a family member in the community? What is the meaningful work that we can do as healthcare providers? It was mentioned yesterday that some of the research on wellness shows that if people are doing at least or right about 20% of what they define as meaningful work, their work becomes inspiring. So I think we have to go back and ask the folks that are with us, what is the meaningful work? And how do we organize our health systems around that work? Once we know that, I think we can start looking at data and outcomes and the KPIs that reflect the meaningful work that we're doing, work that's meaningful to our workforce and to our communities.
So talk a little more about the data. We feel like maybe we don't necessarily know what data we have and what we don't have. And as an informaticist, physician informaticist, what is the data that you're going to go look for now?
Well, it always starts with answering the question, what problem are you trying to solve? And so figuring out what's important, that's number one. But we also learned during COVID that there's a lot of data out there in healthcare. That's pretty obvious. But getting to it and creating meaning from that data can be challenging. Right now, you and I can go on our phone. We can look up the COVID rates in any county in this country. It's available to everyone. That was a very meaningful statistic. It's less meaningful today than it was a couple months ago. What are the new data points that we should be looking at? What about life expectancy? How is that doing in our county, in our primary service area? We know in the country it's been going down since 2014. Can we focus folks on metrics like that are meaningful to our community, and then organize our health systems around addressing those and figuring out, well, what can we do about that? And I guess my question is that one definition of the meaningful work that we can be doing as a health system that's connected to our community and our community's needs?
So as we said, the last 2 years have been grueling for providers. What are you doing to really replenish your healthcare professionals and teams as we're, knock wood, emerging from COVID?
Well, trying to take what we've learned from a really difficult situation and apply it to the future. All of us have been starving, I think, for human connection, meaningful relationships, and it's a great opportunity to bring those back. We're here together, you and I face to face. That hasn't happened in a while. We're at a conference interacting with other people, and we're experiencing the joy of that because it's been denied to us for quite some time. That same challenge is happening in our own teams. We've been Zooming, but we haven't been connecting. So I think we have an opportunity to spend time learning about each other, appreciating each other as people who are involved in mission-based work that's important to our community. So building the time to develop those relationships is key. Working in teams and exploring how to work on teams well, beyond our current understanding, which as a doctor sometimes is limited to, well, I'm on a team and I write orders and then other people follow my orders. That's more like the military than I would call teamwork per se. I think we have to re-examine, look at some of the work by folks like Amy Edmondson, who writes about teaming in healthcare and what does it really take? It's those personal relationships that get leveraged to help us get the job done. I think we can explore that with more depth. And then going back to the data, always going and reflecting on those important metrics to us, to our teams, asking, are we hitting them? How can we do better? And how can we improve? Because at this moment, our communities, they desperately need us. They're suffering, and our team members in some ways are still suffering too. So we have a great opportunity in healthcare to lead this transition out of COVID to something that I think is much more meaningful, much deeper, and reflects a lot of the learning and wisdom that we've gained over the past 2.5 years.
All right, well, let me close with a little bit of an uplifting after that, slightly depressing start. What gives you hope as you look at the next year and the work that you're planning to do? What really gives you some hope in moving forward and continuing to provide the care to your community?
I think we've learned so much about what's truly important over the past 3 years. Right? There's a saying that you don't know what you have until it's gone. I don't think things are gone. I think they went away temporarily, and we realized, wow, this helps me organize my priorities as a person, as a leader, and I think it helps us as a society as well. So I think we're coming out of this more wise, more skillful, and more focused on what's important. For me, as a leader, and especially as a physician, that gives me great hope that we can do even better because of this experience that we went through. And also, I see how much our patients appreciate what we're doing. And that's probably the greatest way of refilling one's bucket, is to see that happening in our communities, the appreciation that patients have and their families for what we do. I think that can motivate all of us to be excited and inspired to come back to work tomorrow and next week and next year, because we're truly doing meaningful, important work.
Absolutely. Thank you so much for joining me and for your thoughts.
My pleasure.